So as a social worker in the hospital, we meet with patients really to overall assess their social, emotional, financial support needs. However, specifically as well within the hospital, our crucial role is really looking at the discharge planning, making sure that all the patients have all the resources that they need before they leave the hospital. Within social work, I think the best thing that I feel most joy is the help, that sense of helping patients in need, whether it's even just providing that extra support. Just being able to go in and listen to someone. Sometimes people just need to discuss something and just letting it out and being able to validate them or saying, I understand how you're feeling. I understand that this can be difficult, or, if they made a big success, like how great is it that you've gone this far? So I think it's being able to see their reactions to just getting that support that they may need. Definitely within social work, especially in the hospital setting, we do focus on the patient who's being treated, but however, also the family and how the family interacts and how the family is involved, especially in our pediatric departments. Maybe if there is a new diagnosis, how is the family taking this diagnosis? Providing that support to the family, the education, making sure that they really understand. Because sometimes I know it could be a shock, especially if it's a new sickness that's happening. And really being able to have them process that with you and to sit there with them and being able to just make sure that they understand, when the doctors or nurses first speak to them, they might pinpoint certain words. So it's really being able to give them that extra support. Right, the most challenging, I think, as a social worker is, and something I feel I struggle with on a daily basis, is wanting to find that answer. Sometimes there is not an exact fix or a concrete answer for what a specific problem is. Sometimes it's having to wait. As humans, we want that instant answer. It's natural. We want that quick fix sometimes. But a lot of the times with certain problems that might be going on, we need to wait it out, or we don't have that quick fix. Yes, so reading, writing, and technology are big. So for instance, reading and writing is very big because a big part of social work is documentation. We document everything that we do with our patients. We're reading the charts, or even to just reading to educate ourselves about different things that are going on. So reading and writing are huge. And then with technology, just keeping up within the hospital system, we now use electronic medical records, where before we were handwriting notes, now we're typing everything. So reading, writing, and technology is very big within social work. So to become a social worker, as far as education, you do need to have your bachelor's degree in social work. I do believe it's even more important nowadays. What employers are looking for is a master's degree. So moving forward in that master's degree as well. To further that, obtaining then your license, so to become a licensed social worker. And one can even go a step further and become a licensed clinical social worker. So with a license within social work, you could work in a hospital, you can work in a school. You really have a vast majority of options. The farther you go in your education, the more opportunities you have. Once you take that step further and you get your licensed clinical social worker, you have that option of even having a private practice and being a therapist, and being able to see your own clients. So you are just giving yourself more of that opportunity. What's also great within the education role is that you do complete internships. I have completed many internships throughout, and it helped me decide where I want to go in my role as a social worker. So one of my internships was actually here within Long Branch High School. I worked with the school-based system. And with that, we completed screeners with the students, just making sure that they're okay emotionally. And eventually what I did have was my own caseload in which I was meeting with students on a weekly basis, checking in, helping them manage, whether it was home life, school life, maybe some issues with peers. So that was one of the things that I really did enjoy was my internships, as well as Monmouth Medical Center was also one of my internships for graduate school. So I'm happy to actually be back here with Monmouth Medical Center because I think growing up, I always knew that I wanted to help people. That was one of my passions. I wanted to help within my own family. Unfortunately, we do have a lot of cancer. So I think that's what sparked my interest in the medical field, really wanting to learn about it. However, me personally, doctor, nurse was not it. So I found a different way of how I could really help people and provide that support. My advice for young people is to not give up, to continue on. Although things may be challenging, it can get hard, it can seem impossible, it's not. Keep going, keep moving forward, listen to your parents, really take advantage of the education, and really get excited about learning. It definitely only gets better from there.